Hello everyone, this is Dr. Ryan House with Cumberland Chiropractic and Sports Medicine. Today we're going to do a video about shoulder pain, but a specific type of shoulder pain, and it's one of those injuries where you're almost backed into a corner because you need to improve one range of motion, but you can't because it hurts every time. So it's almost like you can't get out of this one on your own. It's a cool one. Let me show you exactly where we're talking about. Did you see that? Exactly what we're talking about? Let me show you again. Okay, I think you got it. If this is your pain, stick around. So we're gonna talk about this specific condition of nerve entrapments at the back of the shoulder. We're not talking about pain here. We're not talking about pain on the top of your shoulder. We're talking about pain anywhere behind the shoulder, okay? Not really a rotator cuff kind of thing. More of a nerve entrapment kind of thing that we've got going on. So here's a great scenario, very common. A person sits at a desk or they have poor posture somehow, and then all of a sudden they say, I'm gonna paint 2 rooms in my house. They go to cut in with the paintbrush, they go to cut in that ceiling, and so they're lifting overhead with their arm. They're painting all day overhead. They're like, man, my shoulder is killing me, right? Where we just talked about. So they go to their doctor. Doctor says you need some physical therapy. Physical therapist says, man, you're stuck here. We've got to get you here, right? The problem is every time you go to stretch or rehab this position, the pain happens. You do that for 2 days in a row trying to stretch or rehab, and you get worse pain, okay? So our job in here is to first get the victim, what I'll call it, unlocked. As soon as we get the victim unlocked, then we go to fixing that bully that caused this thing in the first place. That makes sense? Bully on the front, victim in the back. So let me show you those 2 nerves real quick. So this is the back side of a person's right shoulder. I've got to peel away a few layers in order to show you how deep this problem is. Let me hide this deltoid, and let me hide this infraspinatus muscle. That is one of the rotator cuff muscles now. So now we can see there are 2 pretty large nerves here. One called your axillary that comes from way up here in the back corner of the shoulder, and then this suprascapular nerve. And this guy is kind of tricky because he comes from the neck, right? So he's kind of a direct branch off of the neck nerves. So again, this is our victim, and you can imagine anywhere there's a nerve there, that could be the pain location where I'm talking about, the victim. All right, so we know our anatomy now. The solution to this problem is to get you able to do this without pain, right? So that's the end goal. You want to be able to do this or paint the corner without pain. So 2 things have to happen. We have to be really good at finding exactly where that victim that we talked about, one of those 2 nerves are, that where the scar tissue is that's formed around those, which I call Velcro, right? Wear and tear leaves behind scar, scar leaves behind Velcro. So if we undo this Velcro first, right? That's really tricky stuff. It's hard to get that guy unlocked. But when we get that guy unlocked perfectly, then you're like, oh, this is just tight now. I've got to stretch here. So again, this can be a complicated process if you want to get kind of quick results. Our job in here to be very precise at finding where that specific adhesion or Velcro is. If we do that, we get the pain gone, we get the bully loose, and you get freedom from your problem in the long term. So if this problem sounds like you and you've got some back of the shoulder pain, you've either tried everything or you'd like to try us first, we'd love to help you. One of our specialties is shoulders, but even more so, difficult cases where you're kind of backed into a corner. This has been Dr. Ryan House with Cumberland Chiropractic, where we get you better faster.